All right. Well, good afternoon, everybody. My name is Gretchen Kunze, and I'm a pharmacist here in town. I work at Gunderson Pharmacy Cass Street location, which is just a few blocks up the road. I'm also the 2023 recipient of the WPQC Innovation Award. Thank you. Our educational programming continues this afternoon with a session focused on improving communication, understanding communication barriers, and helping improve patient care. Please remember you can collect continuing education credit for this session through the PSW app. If you haven't downloaded the app or if you're having trouble doing so, please just stop by the registration booth and PSW staff will be able to help you with that. This session will be offered as continuing education credit for pharmacists and pharmacy technician learners. The session will also be recorded and offered as on-demand home study continuing education credit. If you have questions for the presenters, please raise your hand and then utilize the microphone in the front of the room, please. First, I am pleased to introduce Dr. Annmae Minichiello, a pharmacist specializing in primary care and community pharmacy at UW Health. She serves as the wellness champion for the ambulatory pharmacy department and serves as a representative for the Student Professional Development and Wellbeing Committee for the UW-Madison School of Pharmacy. Annmae is focused on serving marginalized and underserved populations with a focus on optimizing cardiovascular care. Next, please meet Patricia Gonzalez Clark. As a certified medical interpreter at UW Health, Patricia ensures the Latino community receives essential interpretation services to enhance healthcare understanding. Patricia is passionate about effective communication and bridging cultural divides. You can access the full bios for all our speakers on the PSW app. Please help me in welcoming our speakers this afternoon.
Thank you. And before we begin, I have to say that I'm extremely grateful for Patricia to be here. It is her wedding week. She got married this last Sunday. She's heading to Columbia literally tomorrow. So we are very grateful for her to take time to be here today. Thanks. So we'd like to disclose that we have no relevant financial relationships. And jumping into our objectives, after the completion of the program, the audience will be able to explain the role of interpreter services in the primary care and community pharmacy setting, identify how to work in collaboration with interpreters to communicate effectively to ensure patients' understanding of pharmacy consultations and clinical services, understand how interpreter services can enhance the safety and patient outcomes of individuals with low health literacy, and list the resources and how to become a certified medical interpreter. So before we begin, I want to highlight the importance of addressing equity and how this plays in the field of pharmacy. As pharmacists and technicians, whether we are consciously aware of it or not, we are witness to patient inequities every day. It is our responsibility to tackle these barriers by creating genuine connections with our patients. So I like to introduce this picture from Angus Maguire from the Interaction Institute for Social Change. On one hand, we have equality, and this promotes fairness and justice by giving everyone the same thing. Equality only works, though, if everyone comes from the same place. And as we know, working in the healthcare field, our differences can create barriers to our healthcare. Equity, on the other hand, ensures that people gain access to the same opportunities. Acknowledging these differences and providing ways to overcome these barriers make us advocates for equity, which is something that we should hold ourselves accountable for. So the CDC defines the social determinants of health as conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes and risks. To the right, we see the social determinants of health by Healthy 2030. What many of us may not recognize, though, is that these areas are often not due to choice, Rather, they are something that people are inherently born into. When we look at these examples, I kind of see them as two sides of the coin. On one hand, if an individual has safe housing, transportation, and live in safe neighborhoods, they're on a trajectory path of receiving great education, job opportunities, and higher income. When you flip it, if someone is in an unsafe housing and they don't live in safe neighborhoods, and often people of color, particularly Hispanics and Blacks, they're faced with racism, discrimination, and violence. They lose those opportunities for great education, and they have no access to nutritious foods and physical opportunities, activity opportunities. And oftentimes, even their physical environment are polluted with air and water. So what we're honing on today and focusing on are language barriers and literary skills. Unequal treatment related to these language barriers are associated with unequal access to healthcare and unequal health outcomes. So why is this important? I'm gonna have a poll to the audience just to see how many individuals in Wisconsin have a language other than English as their primary language. And it looks like the app is not working, so we'll just go one by one. A, 125,526. B, 251,547. C, 309,702. Or D, 506,758. So raise, it looks like D. D for the most part. Right, that is correct. So an estimated 8.6% of patients do not speak English at home. And of that fraction, 3.25% of that population, or an estimated of almost 200,000 residents, are considered to have limited English proficiency. So limited English proficiency are those who do not speak English as their primary language at home, as well as have a limited ability to read, speak, write, or understand English. So as you can see, Wisconsin, even though the majority of the primary language is English, we are really composed of a diverse state. So secondary language is Spanish and third language is Hmong. And as you can see the listed, that we have many languages in the state. So coming with another poll question right at you. What percentage of people with limited English proficiency also reported low health literacy? A, 15%, B, 25%, C, 45%, and D, 75%. So mix between C and D there. So the answer is C. Nearly half of the population supports that they do not have English as their primary language, and as well as have low health literacy. So with that being said, there are many negative impacts when someone has low health literacy. They have poor health outcomes. They have higher rates of emergency visits, increase in hospitalizations and death, and worse preventive care and health outcomes for their children. And as in pharmacists and pharmacy technicians, this really impacts us with increases in medication errors. So let's take a look at how interpreters can fit into this. We're going to discuss a couple of scenarios which represents an interpreter role in the pharmacy setting. So when looking at these scenarios, interpreter services are used for all of the following except for A, describing A1C lab results to a Spanish-speaking patient who is seen for diabetes in the primary care pharmacy. B, asking for insurance information for a patient who presents to the pharmacy using short English-speaking phrases. C, inform a French-speaking patient the cost of medications over the phone who also has an English-speaking daughter on the line. Or D, translating a medication guide associated with a prescription. So how many think A? B? C? Or D? Okay. Can be one of those confusing questions because it's all the following except for, so it could be a little opposite there, but. Okay, the correct answer is D. So this is just a good distinction between interpreter's role and translator's role. So interpreter's purpose is to mediate language orally, while translators work with written text. So translating a medication guide would fall under the role of a translator. So the next picture provides a lens of what happens to an individual whose language is not English. As you can see, it can be difficult to understand. The words look jarbled and it can be different to comprehend. And Patricia, you have experience that you would like to touch upon this?
So I always think that whenever a patient, I mean, we all know that patient care is our priority, right? So when we have the pharmacy setting, it comes the same thing. So whenever you give, and that's when equity and equality come to place. So, okay, everybody has their prescription instructions in the bottle where is everything in English, right? I'm sorry, that's equality. But equity is when you actually go the extra step. You actually take the time to translate whatever is that they need to do in the medication, like take it orally twice a day or whatever, but in their own language. So that is something that is very important for the patients in order for them to trust the pharmacist, most of all, and their PCP. Because usually when they don't know what they're taking, they go home and they Google, and Google is no. Don't Google. So sometimes they come to the PCP and say like, okay, so you give me this medication, but it says it's for seizures, but they don't get explained like, okay, it could be for another reason. It works for seizures as well. So that is something very important. The label, how to take the medication is something that is like, if you go to Japan and you need medical care and you are going to fill your prescription and you don't speak the language, I mean, it applies exactly the same. That's how people with a lower English knowledge feel.
So if you're really good at anagrams, let's actually translate to, this is a medication for your heart. Take one tablet 2 times a day. So another learning assessment question. What percentage of patients had a bad reaction to medication due to a problem understanding their healthcare provider's instructions? And then I'll allow time for each to raise hand. A, 10%. B, 15%. C, 30%. Or D, 50%. So the correct answer is B, 15%. Of these 15% of errors, though, nearly half of these lead to physical harm. When a provider or pharmacist or pharmacy technician does not speak the primary language of the patient, a lot of them don't understand how to take the medication, or they even have trouble understanding the label. 16% of these patients have a bad reaction due to medication errors by not understanding the healthcare provider's instructions. This can lead for patients to have fear seeking healthcare because they don't understand their provider. I have personal experience at my practice. I one girl with this that has a high show rate because they have difficulty missing their appointments because they don't trust or understand the provider that they have. And when we take all these factors together, it leads to overall decreased patient satisfaction. So I like to pull the survey that was provided by a former DPH4 student, William Carnes, who surveyed WQHC pharmacies, which are accredited pharmacies throughout Wisconsin, committed to higher standards of medication management, patient education, quality assurance, and patient safety. So he surveyed 72 pharmacies, and I thought this was quite surprising. So nearly 60% used an interpreter less than once per month. And of those pharmacies, the majority, 40%, had a non-English speaking patient at our staff at our pharmacy using less than one per month. So when I look at these results, I think this is a great opportunity to integrate how we can work collaboratively with interpreters, and how can we work as a team to implement them into these pharmacies. So I'm going to pass it off to Patricia, who has her own patient case about a provider who said this to a patient.
So our job usually is like, we are the bridge between provider and patient and vice versa. So usually like we're very busy, so kidney transplant unit usually is like, okay, we need the bed, we need the bed, we need the bed. And they're trying to, like discharge the patients whenever they are well. So it happened that one time some person decided to discharge the patient using is a bad word, but okay, like through his cousin, right? So just for starters, that is liability. You cannot utilize someone that is not trained, certified, and that has the experience, because even if you have English as your first language, there are people that are born here that don't understand the medical lingo. So they don't take that into account. Imagine if some people don't understand that being born here, imagine one of us like, what's that? So one time I get the patient in the ER. So, okay, I go to the ER, and then the doctor is, questioning the guy. Well, okay, we can take all the measures here because your kidney is being rejected. So then when the pharmacy part started, like, okay, so what are you taking? What are you not taking? So he stopped taking anti-rejection medication. So the doctor is like, okay, so what happened? Did you run out of it? You don't have the means to get it? Is it too expensive? Like, what happened? So, because like, no, well, when I was discharged, my cousin told me that medication, I could stop taking it. So, yeah, he was an emergency case. It was another organ that goes to waste because, and that's the reason why there's an emphasis about that. And, like I said before, one-on-one interpreters are usually busy because it's like so many of us in just the whole hospital. Sometimes, we're getting phone calls and scheduling and doing all that stuff. So it pays to be a little bit patient. I know it's a pain to wait for the interpreter, and you guys need to, well, not you, but like the floor needs to have the patients go out of the hospital already. And you're like, okay, so we have to wait, but it pays off, because cases like this, I mean, I'm sure that's not the only case. And I'm sure that I'm not the only person that has had something like this happening to a patient that just got a brand new kidney for him, and then he lost it because misinformation. So the liability part, this is the part that I really like. So I go to clinics and I go to the ER at on call, or pharmacist or whatever needed, right? So usually what patients do is they say like, oh, I speak English and I'm going to interpret for my mother or for my cousin or for my kid or for whatever, right? So that sounds like really good. But what they don't understand is like the fact that you're bilingual, that does not mean that you actually have the capacity to interpret. It's not like that. So you need to be trained. You need your license. You need all of that. So whenever people come to the ER, go somewhere and they start making faces like, we don't need an interpreter. We didn't ask for an interpreter. So, okay, you didn't, but your mother is a non-English speaking patient. So I'm here for your mother, not for you. So when you start telling the people, okay, if you want to interpret, we have a waiver in the system at UW. And whenever people just come at me like, we don't need you, we don't want you. And so we come out with the waiver and like, okay, this is for liability purposes. So whatever you say, it goes to you. So we have nothing to do with this because you decided to interpret. And that means that we're going to unflag the patient because it does not require an interpreter. So that's how we do it. If you don't use the interpreter, then the kidney patient case is, because they don't understand how to take the medication.
And then another part of that liability is that at the site I work at, we actually have a lot of technicians and pharmacists who can speak Spanish. However, a lot of them are not medically certified. Is there a question in the back? Oh, sorry. And there was an instance where a technician who is bilingual, they had asked the patient the address and the patient confirmed and everything. And it actually turned out to be their cousin who they weren't picking up for. So again, it's that liability piece that we have to think about, that even though someone may be comfortable in speaking and bilingual, they really do have to be medically certified to understand those clinical terms. So next learning assessment question, what percentage of errors is reduced when using a medical interpreter? A, 5%, B, 10%, C, 20%, or D, 30%? All right. So it's actually B, 10%. And I want to point out that even though this does not seem significantly percentage-wise, let's refer back to the amount of patients who don't speak English in Wisconsin. This equates to 101,351 potential errors versus 50,675. So again, percentage-wise, not so much, but when you take it into account to individual patients, it's really important. And this is also highlighting the importance of non-trained and certified, because those who are non-trained can have that 20% clinical consequence error rate. So we have another learning assessment. Just explaining the role again. Interpreters offer a vital role for eliminating medication errors for hospital discharge patients through all the following, except for A, help patients comprehend the importance of taking their medications and continuing them after discharge. B, offer supports to patient and family caregivers in shared decision-making process. C, provide discharge paperwork in the primary language of the patient. And D, reinforce preventative care by outlining the medical plan correctly to allow for continuity of care. Okay. So how many people think A? B? C? All right, C wins. That's what we always say, right? Answer C when you don't know. Or D. All right. So again, it's just interpreters can help provide the importance of taking medications and offering that good continuity of care. So I have a quote from Dr. Rachel Naomi Moreman, who is a pediatrician and author of Kitchen Table Wisdom and My Grandfather's Blessings. The most basic and powerful way to connect to another person is to listen. Just listen. Perhaps the most important thing we ever give each other is our attention. A loving silence often has far more power to heal and to connect than the most well-intentioned words. So I really love this saying because as healthcare providers, whether pharmacists, pharmacy technicians, is this idea of generous listening. Generous listening offers us with an open mind, with compassion, and without prejudice or agenda. And often when we communicate to patients, we have passive listening. So it's just reinforcing that need to be empathetic to any patient that we connect to. So interpreters are vital in creating that safe and open space for patients. They're not just creating or interpreting our words, they're building that connection. And ultimately, they serve as an advocate for that patient when no one else can. It's their responsibility for their family, caregivers, to feel comfortable and to feel heard, to ensure that they're understanding their healthcare plan, and to make them feel that they're part of the health decision-making process. So how do we work with interpreters? There are a couple tidbits on the slide that we'll go through. One is that we want to speak slowly, use a low number of syllables, engage in eye contact, and use health literacy-friendly terms. Okay, we have another patient case. So a 64-year-old Hmong male arrives at the pharmacy to pick up a prescription for atorvastatin. You call interpreter services via the use of an iPad to help assist with the drug consultation. Which of the following communication strategies are important to remember? A, maintain eye contact with the interpreter when speaking to the patient. B, allow breaks during the consultation to allow time for the patient to speak. C, speak at the same rate of speech you would speak to an English-speaking patient. D, use no more than 4 syllables per word when communicating to the patient. Or E, speak louder to the patient, even if he does not have a hearing problem, because speaking louder will help people to understand you better. So how many think A? B? C? D? Or E? I think B1. I'm going to actually have Patricia go step by step through each answer.
Okay. So usually like the way that you work together with an interpreter is like you have to keep eye contact with the patient. We are supposed to be invisible. So I'm not here, you're talking to the patient and no eye contact with me at all. You have to make sure that the patient knows that you are listening to them. I just go blah, 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 blah. So whenever we are interpreting, is good when you guys go slower. That give us time to, to retain and actually be able to do continuous interpreting. The other thing is that whenever you guys talk, it's good to not try to yell at the patient. He or she or they won't understand what you're saying, even if you speak louder. And I have that a lot with my providers, they go like, how are you doing today? And the patient is like, what? So yeah, it does not help. So the best thing to do when you're using an interpreter is enunciate well, because obviously we are not from here, so we want people to speak like clearly to us. So enunciate really well and try to go in breaks, not go like, well, I think that you have like a high blood pressure and you need to exercise and da, 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 and then you guys keep on going and then we're like, oh, hold on. So to avoid that, you guys just like in a slower pace than most people would actually speak normally. So that would help us a lot.
And then I know I'm guilty of E, just because when we think about talking to patients, sometimes our automatic thought is, oh, they don't understand me, let me speak louder, because we think they're not hearing. But again, as Patricia mentioned, yelling at the patient, speaking loudly actually makes us look a little bit more volatile and violent. And again, we want to address that empathy coming from that empathetic approach. And then going to have Patricia here share her journey of how to become medically certified as an interpreter.
Okay, I don't know if before I come to this, I could say I am from Colombia, and this is the first time that I am around legal drug dealers. So it feels so good. It's really good. So you guys are awesome. The other thing that I wanted to share with you guys is that before I go to how to become certified, I have had physicians or NAs or you name it, like any quantity of providers. When my patients come to the clinic and they are asked, so how long have you been here? And the patient, says like, well, I've been here for 22 years. I've been here for 30 years, for so many years. And then the provider goes like, how come you don't speak any English? I mean, what have you been doing all this time? And you have to take on the English part. So yes, if you go to a different country, completely understand that you should take up their culture or whatever. I mean, bring a little bit of your culture and just keep it to you or whatever. But people are not, they don't have empathy with that. When you immigrate to a different country, especially for the Latino community, and the biggest Latino community that we have is Mexican, right? Here in the United States. Sometimes I have patients that have up to 3 jobs to be able to provide for the people they leave behind. They just come here to work. They never have time to get sick. They never have time for anything in their life. So whenever, when you don't take care of yourself, then it's when diabetes hit, that's when hypertension hits and everything. Then they fall ill, they have to come to the doctor, and that's when this happens. So, that's very, I mean, you shouldn't say that, basically. And it's been said, let's say that. And the way that we feel when somebody says that is like, I don't know, like me as an interpreter, I'm trying but I do have the obligation and I have to say everything that is said in the room. So I have to say it. The other thing is whenever I have patients, there are patients that I have that do not write or read Spanish. So we get to the forms and something, and they're like, I can read it. So, I mean, I know it's a pain, but, it's like taking all those things into consideration. I have worked with fabulous pharmacists, and they usually ask the patient, do you read Spanish? Do you write Spanish? I mean, it's a good way to ask, because you never know. So I just wanted to put that in there before I would say how to become an interpreter. So whenever you are bilingual or you have some other language knowledge, you have to take an exam through interpreter services to be able to talk one-on-one with the patient. That is because of the error, that's because of the liability. My nephew, he's an anesthesia resident. He was born in Colombia. He had to do the test in order for him to be able to talk to the patient, right? So it's not, if you're from a Spanish-speaking country and you are supposed to be interpreting, that's not true. You need to be trained for that. So the way that you do that is you can do it online. You can go to the cchicertification.org. Back in the day, the way that I became an interpreter, that was like 23 years ago, other interpreters would do the assessment. And that's how you would actually get to become an interpreter. And it was like, like the top interpreters at the time. Then probably 10 years ago, we started like, okay, people don't take us seriously. People don't think that this is a profession. People think that we're just like there and, oh, well, okay, you're getting paid to talk. No, it's not that. So that's the reason why there was a decision to make a certification. So we need to get our license renewed every 4 years. And the way that you can do it is, like I said, go to that website. The way they do the exam is through a computer. Actually, I did it in La Crosse University. So, so they just start asking you things, and then they ask you to interpret and to translate. So when people say, are you the translator? No, I'm the interpreter. Interpreting is verbal, translating is on paper. So that's the difference. The other thing is that you can go to the online course, Rock Valley College, and there is well, it's not working. So it's Rock Valley College. Got it?
Yeah, got it.
So there is the website for them. The other thing is that the exam is translating, is oral, is written, and is role play. You can also go and try to become a certified medical interpreter through MATC. They offer classes, and it's a profession. I can't do anything. Sorry.
No,
Okay, so this is a learning assessment. So which of the following are ways to become a certified medical interpreter? Enroll through a certified online course accredited by National Commission for Certifying Agencies, NCCA. Pass the CCHI certification oral and written exam. Become certified by Google and work as a translator for Google Translate, or A and B. A and B, everyone? Yes. Google is your enemy when it comes to do these things. Like, yeah, I need a CAT scan. Okay, she needs a radiografía de gato. So yeah, no, doesn't sound good at all. So like the other thing is like whenever you use Google Translate and you tell like just put film underneath your tongue, and then you say like, okay, coloque una película debajo de la lengua y disuelva. So that means that you're telling the patient, place one movie under your tongue and dissolve. So that's how many people, and that this has happened a lot. And that's one of the reasons why whenever, they call interpreter services, they're like, okay, so do not use Google Translate because it's extremely inaccurate. It doesn't work at all and confuses the people even more. Yeah, I can do that.
So in summary, Dr. Google does not always have all the right answers. So what are the next steps? So hopefully by the end of the presentation, we realize that in order to increase patient satisfaction and safety outcomes, it is necessary to work collaboratively with interpreters. However, there are a lot of barriers to interpreter access. Literature shows that with integrating interpreters into a care team, it's a really complex endeavor that requires many steps to employ certified interpreters, as well as have staff properly trained. So we have to discover ways how to source funds for interpreters. It's a good thing to know your practice site's resources. If you work at UW Health, sometimes pharmacists don't know that we have access to interpreters 24/7 through their telephone, iPad, or even in person. It's great to be certified and medically trained, and to build awareness of the interpreter's important role on the healthcare team. We need to identify and respond to these language needs to create organizational change. Collaborating with interpreters allow us to capture those patients who are lost through the cracks, those who can benefit from having someone as an advocate to their team. As we have discussed before, patients who do not speak English as their primary language and have an English-speaking provider often creates that barrier, and they're unlikely to show up to their visits, which is why we need to work with interpreters. This allows and facilitates for engaging and building and trusting relationships. So to leave a quote from Julia Penelope, who is an American linguist, author, and philosopher, "Language is power, in more ways more literal than most people think. When we speak, we exercise the power of language to transform reality. Why don't more of us realize the connection between language and power?" So again, it's just important to work collaboratively with your team and your resources, again, addressing that empathetic care that we all strive for. So right now we're happy to take any questions from the audience.
Oh, geez. Good afternoon. So recognizing, I guess, what best practices or strategies would you suggest then if we are interfacing with patients that have a language barrier, where we don't have the benefit of being in the infrastructure of a health system or some other larger structure where interpreter services are readily available? Because I think that's the $1 million question, right?
It is. Well, the best thing to do, I mean, obviously you're going to make sure that the person, first of all, you need to make sure that you know exactly what is the language that they speak. Because, you know, like we get people from Africa, we get people and they have like different tribes, and everybody speaks different dialects, different languages and stuff like that. So like Annmae say about language service, like at UW, we use specific interpreters. So like everybody has that card. And I know, like, you know, like for like what you said, if you don't have that, it would be some good idea to try and see if there could be like freelancers. You could actually like, Google it, like certified medical interpreters, and make your own network, like just on call. Just, hey, I have a patient that speaks this. Are you available right now? Can you help me out? And you can do it that way. Other ways is like to be, you know, affiliated with Pacific interpreters or a language line, like used to be called like back in the day. That's the most accurate answer that I could give you.
Thank you. A quick question. Help me understand, if you're English as your first language, healthcare provider, and you do your training here in the US, but you've taken Spanish language throughout and developed a modicum of proficiency. Are there any legal issues with using that little bit of knowledge? Do you have to go through translator certification in order to use Spanish in actual patient interactions?
Yes. When you are not a native speaker, or even if you are, like I said before, my nephew was born in Colombia and he had to do an exam in order for him to be able to talk one-on-one and for him to be able to tell his supervisor, like, okay, the patient is saying this. I mean, to lay out the plan and run it through him, like, this is what's going on. The other thing is, like, I have doctors, for example, like, they are Spanish speaking, but the way they speak their Spanish, some people understand, some other people really, like, they ask me again to interpret the Spanish that the provider is telling them. It's like, what did he say? What did she say? Like, I don't get it. So that's the reason why, for liability purposes, like, I mean, if you say something that, like, they don't understand, and usually, unfortunately, patients think that they are the ones that pay interpreter to come in there. They don't realize that it's a service that is free to them and is, their right to have someone there to explain everything that is going on and what's the, like, the plan for action for their health. And for that test in Spanish, you need at least 80% to pass and be able to be a provider that is actually, like, able to do one-on-one with patients.
And then I actually have, in addition to that, so my husband, he's a provider at UW Health, Yahar Clinic, and he's actually a medically certified trained interpreter in Chinese and Spanish. And even though he learned those languages through high school and college, and he was actually a medical interpreter during medical school, annually he does have to take those exams yearly to pass in order to speak to patients in those languages. So it is actually a liability and a legal thing if you don't pass that test every year. So, and according to him, and he has excellent Chinese and Spanish, it is a very difficult exam. So, and then I believe, yes, there is another question.
Do you use interpreter services for post-visit or post-discharge follow-ups? Because I feel like that would be a great area to make use of that, especially like the transplant example that you gave us. If someone had been able to follow up and confirm that he was taking his meds right, would have been great.
Usually when we do discharge, obviously the patient is flagged in our system saying, like, Spanish speaking or Arabic or whatever. So usually what the nurse that is discharging asks if they want a courtesy call the next day or the next week to see how they're doing, if they're developing, like, any reactions to the medication, if how are the symptoms going, if he's giving him, like, lightheadedness, like, all that stuff. So usually, yes, and it's flagged in there, and they type in capital letters sometimes, like, needs interpreter for Spanish. So, and they are very good at it. So they call Pacific Interpreters. It's a 3-way call, and then provider, patient, and interpreter.
There any other questions from the audience? Great, fantastic. Thank you so much for your time and listening. Appreciate it. Oh. And of course, the code.